revision. Okay, so here are the SDGs, the focus of Unit 4, Area Study 2, and the ones that we're going to be focusing on are no poverty, number 1, zero hunger, good health and well-being, and quality education, meaning that good health and well-being is the main one, right? So you need to be able to link all the other ones to that one. Then we're having a look at gender equality and clean water and sanitation. So we've already looked at some of this stuff throughout, Unit 3 and Unit 4. You just need to be able to, sort of know it in the context of the SDGs, right? We've learnt about poverty, we've learnt about education and gender equality and clean water and sanitation. Now you just need to be able to link it in terms of the context of the SDGs. And then we also have climate action, which again, we've learnt about. So, what are the SDGs? There are 17 goals to be achieved by the year 2030, right? So we've got 7 years left to be able to achieve all of this. It was introduced by the UN, and its aim is to end extreme poverty, fight inequality and injustice, and tackle climate change. Okay? And the goals that we need to know are 1, 2, 3, 4, 5, 6, and then 13. Okay? So just those 7 goals, that's what you need to know. What do you need to know for each goal, other than for number 3? You need to know the aim, a brief description, why it's important, right? And how it can, on its own, promote health and well-being and human development. And then how it can work together with goal number 3 to promote health and well-being and human development. Okay? So this will sort of make sense as we go over the next slides. And then what you need to know for goal number 3 specifically, so not for the other ones, is aim, brief description, why it's important, key features, and then how it can work together with the other goals to promote health and well-being and human development. Okay, and these are the rationale. So the rationale was mentioned on the study design, so you do need to know it. You don't need to know it word for word, but it helps to have a particular wording memorized. Okay, so build on the MDGs. What are the MDGs? They were the Millennium Development Goals, right? They were introduced in 2000 and expired in 2015. Okay, so the SDGs are working to achieve what the MDGs couldn't, right? In terms of education, health and well-being, and specifically the environment as well. Okay, so it's really important that you know why we have SDGs when we already have the MDGs, is to build on what we already had. The other reason for having these SDGs is to address new global challenges. There has been an emergence of many new global challenges since the MDGs were in place. Right? So we have conflict, mass migration, and climate change that needs to be addressed, right? So these definitely existed back then, but the extent of these global challenges is completely changed, especially with the introduction of, all these technologies and things like that, and the population increase especially. And then progress in all areas was uneven, right? So several groups were disadvantaged, particularly those who were poorer, female, young, disabled, specific races and specific places in the world. And this needed to be addressed. We needed to make sure that all people had equal access to the achievements from the SDGs and MDGs. Okay, so those are the rationale. Okay, so these are the 3 rationale, the reasons why we have these. And these are the objectives. Okay, we've got end extreme poverty. We've got fight inequality and injustices and address climate change. So you need to know this, the reasons why we have them, and then you need to know what we are hoping to achieve, right? We want to end extreme poverty, which is the number of people, living under a certain type of, a certain number of dollars per day, okay? We've got fight inequality and injustices and address climate change. And you definitely need to know these as they are very popular identify questions, so make sure that you know these really well. Alright, so the United Nations established the Sustainable Development Goals back in 2015, and the goals are underpinned by the 3 dimensions of sustainability: social, environmental, and economic, okay? So part A is asking, what are 2 other objectives other than end extreme poverty, and explain why each objective is important, okay? It's 4 marks. So, what are the other 2 objectives? If we have a look here, it is fight inequality and injustices and address climate change. So why is fighting inequality and injustices really important? To ensure that each individual in the world has equal access to all of the benefits from progress from the MDGs and SDGs, right? To ensure that each individual is treated the same in the world. That's why it's important. And then climate action is really important, to address climate change. It's because we need to ensure that we know that we continue to have our Earth available to us, right? So you need to be able to explain why ending climate change and addressing climate change is really, really important. So, a common error was to state the names of the SDGs instead of the objectives, right? So, you're not supposed to talk about SDG 13, which is about climate change. You're supposed to talk about the objectives, right? So, a high scoring response had the precision of talking about fight inequality and justice, as important as the inequalities around the world can cause conflicts, a lack of rights in certain communities such as LGBTQ+, and lack of power in women due to inequalities. Okay, so they need to be addressed. And then tackle climate change is important as rising sea levels are causing environmental sea issues. Changing weather patterns can result in a lack of crops, like leading to malnutrition and things like that. Okay, so we need to be able to save the environment for the future. So if you're able to talk about why addressing climate change is important and why, ensuring that everyone is, no one has inequality and injustice, then you're able to get 4 marks. Alrighty. So, here we come down to the big bad, SDG 3, right? The really, really important sustainable development goal that we're going to be focusing on. So, SDG 3 is called Good Health and Wellbeing, and its aim is to ensure healthy lives and promote well-being for all at all ages. For all at all ages, okay? And the key features are to reduce global maternal mortality, okay, end preventable deaths of newborns and children under 5 years of age, and end epidemics of AIDS, tuberculosis, malaria, hepatitis, and other communicable diseases. Okay, and then reduce premature mortality from non-communicable diseases. So if you remember, communicable diseases are things that can be spread, from one another, whereas non-communicable diseases are like non-infectious diseases. Okay, so think about your CBD, your cancers. Those are things that cannot be transferred from people, and we're trying to end these epidemics and reduce premature mortality. Another key feature is promoting mental health and well-being, okay, reducing the prevalence of mental health conditions, reducing global deaths and injuries from road traffic accidents, and ensure universal access to sexual and reproductive healthcare services, achieving universal health coverage, and strengthening the prevention and treatment of substance abuse. Okay, so although the phrase health and well-being is featured in this SDG's name, this does not relate to the 5 dimensions at all. This is what we're talking about. We're talking about it in terms of SDG 3, reducing global maternal mortality, ending epidemics of communicable diseases, non-communicable diseases, mental health and well-being, etc. So, 2 different things. Make sure you don't start talking about health and well-being dimensions when you see this specific wording of good health and well-being. Alright. The other thing that you need to note is that these features are like aspects, right? So anytime SDG 3 is referred to, they're like the characteristics of, physical health and well-being. You need to be able to link these aspects anytime it's like, how does this impact the ability to achieve SDG 3? You talk about this, right? So it's like, how does this help us achieve good health and well-being? You talk about this. This can enable us to achieve universal health coverage. This can enable us to reduce global maternal mortality, right? So these are the things that you need to know and kind of need to memorize, but the more you practice answering questions, the better you're going to get at it. So, maternal mortality rates are really, really high, especially in developing countries. But having mothers in good health means that they can take better care of their families as well and stimulate a good developmental environment. So that's why this is a feature of SDG 3. And then children often die from easily preventable diseases like malaria, pneumonia, diarrhea, and this can easily be prevented through vaccines, healthcare, clean water, and sanitation. And then communicable diseases are a great risk for larger populations, and they can be prevented through improvements in healthcare and education. And non-communicable diseases are preventable and not only need a greater focus, usually through government efforts to be reduced as much as possible. So these are our 4 main focuses, which is children dying from preventable diseases, maternal mortality rates, communicable and non-communicable diseases. So VCA has made much more of a focus on SDG 3 and how the other SDGs essentially all link back to it, right? So from 2018 onwards, there's a lot of questions focusing on this sort of aspect, and that's what you really need to know, right? So always be able to link it back to SDG 3, good health and well-being. Right, so keep that in mind when we're having a look at these. So, what is SDG 1? No poverty, right? So it's basically aiming to end poverty in all forms everywhere over the next 15 years, okay? And the description aims to eradicate extreme poverty, currently measured as people living on less than $1.90 a day. And it aims to reduce poverty by at least half, right? And that's by implementing social protection system. So if you don't know what a social protection system is, for example, in Australia, we have Centrelink, where you're ensuring that disadvantaged people also are provided money so they can, continue to live and not, have to resort to extreme means or, die as a result of complications. SDG 1 is predominantly addressed by the welfare sector, so keep that in mind. And remember, poverty refers to the deprivation of basic resources, right? So it's not just about the money you have, it's about, not having resources required for human living, like food, water, shelter, and healthcare, okay? So why is the SDG 1 important? An inability to afford food can lead to hunger and malnutrition, and that can weaken the immune system and lead to increased mortality and morbidity from infectious diseases. It can also lead to this inability to afford healthcare, a lack of vaccination and things like that. Lack of access to clean water and sanitation can lead to waterborne diseases, so things like your cholera, your typhoid and things like that, and that can lead to more mortality. And how can working towards it improve health and well-being and human development globally? So not SDG 3, we're looking at human development and health and well-being. It can end hunger and malnutrition, reduce burden of disease, afford healthcare, can reduce maternal and under 5 mortality rates, and clean water and sanitation can reduce mortality from waterborne diseases. So don't waste your time memorizing different things when all you need to do is sort of just flip this around, right? So it's important because this, and then it can improve this by, sort of just linking the same things. Okay, so always use your answer, be smart in your answering. You don't have to always memorize all the different things, just memorize the key aspects of each topic. Cool. So why is it important? So you need to you can't afford this specific thing, right? You can't, for example, as a result of poverty, you can't afford healthcare, and then a negative consequence. You can't access schooling, right? You can't access education, a negative consequence. And they aren't aware of, a specific type of thing, they're not aware of the dangers of smoking, a negative consequence, right? So that's how you generally structure your answers for SDG 1. So how can it work towards improving health and well-being and human development globally? If they can afford this, then they can. If they can access, for example, education, then they can. And if they're aware of, using protection and having safe sex and reproductive actions, then they can, improve their physical health and well-being. Okay, so that's generally just how you need to be structuring your answers, because in HHD, it's really easy to answer the questions once you nail down the structure of a specific answer to a question, alright? Because it's really sort of formulaic in terms of once you understand it, you're able to create these sort of structured answers. Okay, SDG 2, we're thinking about zero hunger, okay? But primarily just link it to something you already know, which is food security. So the aim is to end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. And there are two sides to zero hunger. There's adequate nutrition, which is ensuring all people have access to adequate food, and hunger globally, and then sustainable agriculture, which refers to, improving farming practices to increase the yield and the sustainability, right? To ensure that farmers are not using the same sort of soil and ensure that it's sustainable in future. And also to increase agricultural productivity and implement sustainable and resilient agricultural practices. Okay, so this is predominantly addressed by the agricultural and nutrition sectors of government. SDG 4 then refers to quality education, Okay, and its aim is to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. And the aim is for all boys and girls to have equal access to high quality, free and equitable education, right? You want to build and upgrade those education facilities, increase the number of youths and adults with, technical and vocational skills for employment, and eliminate gender disparities in education, right? Because as currently too many girls and women do not have access to education, so we're trying to eliminate those gender disparities. And ensure all people receive education to achieve literacy and numeracy, because there's a huge population of the world who cannot read or write or count. So we need to ensure that those people get access to education. Gender equality, it refers to achieving gender equality and empowering women and girls, right? So we need equal access and participation to political, economic, and public life by addressing the barriers to gender equality. Ensure that all females have the same opportunities as males. End discrimination and violence towards women and girls. Ensure universal access to sexual and reproductive health and reproductive rights. And ensure women's full and effective participation in decision-making at all levels of life. So that women are making their own decisions for their own lives rather than other people interfering. Clean water and sanitation, its aim is to ensure availability and sustainable management of water and sanitation for all. Okay, and this is more addressed by the water and sanitation sectors. So this is to ensure that everyone has access to safe and affordable water and sanitation. Right, we need sanitation facilities, and we also need to invest in adequate infrastructure and encourage hygiene practices. Alright, to promote the safe reuse of water globally. So we're not wasting water, we're reusing water, but we're not reusing contaminated water. And then climate action, addressed by the climate sector, aims to take urgent action to combat climate change and its impacts. Okay, and the description is we need to strengthen resilience and adaptive capacity to climate-related hazards and natural disasters, right? So your bushfires, floods, droughts, everything. Have a plan to alleviate climate change's effects, right, through national policies, strategies, and planning, right? So, for example, if there are neighbor nations that are, for example, relocating, having plans to help alleviate the stresses caused by them having to relocate, especially for low and middle income countries, because they are disproportionately affected compared to high income countries by climate change, and to improve education and awareness to mitigate climate change. Okay, so those are the 7 sustainable development goals that you need to know. Right, so now we have a VCAR question, so question 7CII from 2018, and it asks you to explain how actions taken to achieve SDG 4, which is quality education, could assist in achieving SDG 3. So remember, SDG 3 is good health and well-being, and that's the one where the key features are, reducing maternal mortality rates, reducing under 5 and children mortality rates, ensuring that communicable diseases and non-communicable diseases, those epidemics are ended. Okay, so how could quality education assist in achieving that? Well, one impact of having quality education is that it can lead to more awareness about, safe reproductive practices and, birthing practices, and that can lead to lower fertility rates in many countries and reducing the number of, young women being married off and having, babies at a young age, right? Because that's very, very risky when many, many young children are having babies. There's increased risk of maternal mortality. So that can assist in achieving SDG 3 because it can reduce the number of maternal mortality. Right, and then another aspect of SDG 3 you could talk about is, your non-communicable diseases. So quality education, people can attain jobs, right? Because if you have education, you're more able to get employment. Then you can earn an income and you're more able to afford good quality food, fitness and things like that, reducing the risk of, non-communicable diseases like CVD and things like that. Okay, and same with communicable diseases, you're more likely to be able to access healthcare when you have quality education at a young age, meaning that you can sort of diagnose and treat your conditions early on, reducing the risk of mortality due to communicable diseases. So those are the sort of 3 things that you could link to SDG 3 to, but obviously there are many, many things you can talk about. But VCAR has stated here that many students struggle to provide the necessary understanding. Okay, so you need to link at least one component of SDG 4 to a specific feature of SDG 3. So here, SDG 4, quality education, addresses the importance of girls and boys around the world having equal access to high quality education. Okay, so needed for meaningful employment. So when girls and boys around the world have access to high quality education, they're likely to have high levels of health literacy and be aware of the safe sexual practices. Okay, that can reduce the risk of these children contracting STDs such as HIV, reducing the spread of HIV/AIDS. Okay, and that assists with the achievement of key feature and epidemics of communicable diseases in SDG 3. So this student has focused on one particular feature of SDG 3, which is to end epidemics of communicable diseases, and then really fleshed out their answer to get those 3 marks. So it's a really, really high scoring response. So I recommend, structuring your answer in a similar way. Where when you're brainstorming, of course, you have all these different ideas about SDG 4 and SDG 3 linking together, but in your actual answer, having that level of depth is really what gets you over the, be able to get like the best marks.